In this first part of our holiday safety series, we're going to focus on the heat. Welcome back to the Pause and Effect podcast. I'm your host, Dr. Cara, and today marks the first in a 3-part holiday safety series with returning guest Dr. Nic Stirk from Watercress Vets. Why does hot weather cause such a surge in emergencies? From heat stroke to bee stings, snake bites, and even near drownings. By the end of the episode, you'll know the signs to look for, the breeds with the greatest risk, and the first steps to take if your pet gets into trouble.
Literally every minute counts.
And which pets are particularly vulnerable?
So those are our little flat faces, so the brachycephalics. So you're getting your Bostons, your little Frenchies, the bulldogs. Bottom line is cool them down and as quickly as possible. Jumping in the pool, keeping their head above the water, and even on the step and just sponging. Any dog can get it, but we do find, because the thermoregulation is not nearly as effective in the flat-faced dogs, that they tend to be more prone to succumbing to the heat stroke.
So we, in the event of knowing that this is a collapsed dog, are already setting up
correct.
IV fluids, drawing up medication, informing staff not to make them sit and wait in the waiting room. So
because depending again on the severity, literally every minute counts.
Dr. Nic Stirk, welcome back.
Thank you so much for having me again.
Okay. We've done a few of these, but we spent our Sunday, just to give some context, doing the rabies drive-through here in partnership with Watercrest, KZN Animal Training. Daniel Stewart was around. It was fun. We got through quite a lot. It was a hot day.
So that was for World Rabies Day on the 28th of September every year. So we try and centre it around that so that we can get greater awareness about the seemingly endless tide of rabies that's affecting us at the moment. Big shout out to people. One of the things we said and we needed to make people aware of is that this is rabies. It's only rabies. And we're seeing an influx of different cases, and this is where this concept came about, that we are seeing seasonal stuff start to crop up. The typical appointment list of Parvovirus, heart failures, heat strokes on the hot days. So this podcast is a bit of a collective discussion on take-home messages and just to give some awareness as to sort of what owners need to be maybe mindful of or aware of. I think probably one of the first ones I'd love to talk about is Parvovirus. With the warmer weather, are you starting to see parvo cases? We haven't yet, but I have heard of neighbouring practices, that have got it. And one bit of a disconcerting thing that you mentioned, that we did the rabies drive. So when we've been looking back in the patients or the dogs and the cats, not the cats, the dogs' vaccination cards, they haven't really been keeping up for the general annual vaccinations as well, which includes then the parvovirus. So yes, obviously it's very, very important in puppies to get them with their core vaccinations, but it is still advisable to carry on with that for a good number of years, because they can still theoretically get it. They might not be symptomatic, but they can still be then shedding into the environment as well, which then unvaccinated dogs or puppies will then certainly be susceptible to contracting it as well. One of the most horrific diseases. I wouldn't wish it on anybody. And I think if anyone's anti-vaccination, they need to spend some time in an isolation ward at a veterinary facility and just see what these poor little puppies have to go through.
I had to put a puppy to sleep today. In fact, you were around. Our colleague admitted this dog when we were doing the rabies drive. And we want to try and help these, and we have to really intensively manage and support these poor dogs, and there's no guarantee.
No. And that little one had already had one vaccination, so there should have been some form of immunity already. So that just goes to show how important the vaccination is, especially as a puppy. They need to have at least 3 of their core vaccinations, which includes then the parvovirus in that vaccination. So one vaccination is not necessarily going to be protective.
No. So that's the first thing. Obviously, I thought it was just so relevant because we saw so many, as you say, so out of date in terms of their routine vaccinations that owners have thought, I've gone for the rabies tick, that's now done. And it's just to remind people that that's great. There's a legal requirement to do, particularly in this province, to do rabies once a year, because we've had so many outbreaks, but not to neglect the 5-in-1
and the annual
dogs.
health check, which is ultimately what gets incorporated into the vaccination consultation as well.
Which flags up so many things, checking lumps and bumps, general discussion on, we've gone through all these things, but, weight discussion, nutrition, it's opportunity for a full clinical examination.
That's
So critical.
Yeah.
So taking a couple of steps back, I have this discussion quite a lot with people, and they go, I don't understand what you mean when you say that your work is so seasonal.
Yes.
That why would you get quieter during the winter months, and why do you see such an influx during the summer months? Can you give your explanation? Because I'd love to hear your take on it.
Well, certainly we've already seen an influx of skin cases and ears coming through. So we fortunately had quite a cold winter this year, and maybe 1 or 2 days of rain. So the humidity has been certainly not as high as what it normally is here on the East Coast here with us in KZN. I can't really speak for the other drier provinces, but KZN is known, if your dog is going to have even the slightest inclination of getting a skin condition, if they're living in KZN, it's probably going to manifest itself. So we do find, with the plants that are coming into flower, the grasses are all nice and lush. I remember as a kid getting out of the pool and then wrestling around on the grass, and then you are itchy because of the plant fibers and the grass hairs and the likes of that. Same thing with our animals. Obviously, they're exposed to it a lot more than what we would be. It tends to look like that freshly cut grass tends to aggravate potentially the feet more so than anything, and wet freshly cut grass seems to be even more triggering than just normal cut grass. So of course now during the growing season we're starting to get our first rains coming through, humidity has shot up, we're getting some hot days again, which again increases the humidity. People are now cutting their lawns again, so we are seeing that correlation. Ears are also in association with that. If you're getting any sort of skin reaction, tending to be the feet, like on the inside of the thighs, in the groin area, on the belly for those little dogs that don't have a lot of fur or hair
low to the ground,
precisely that. In the little armpits, and then the ears as well. So the skin does extend into the ear canal. So if the skin in general is irritated and itchy, the likelihood you're going to get some sort of ear infection or an overgrowth of either yeast, bacteria, because of the humidity as well. Dogs will start swimming again, even though dogs are like kids, that they tend to swim regardless of the weather, but generally more so in summer. So certainly water and humidity, particularly with the ears as well, can spark off the otitis.
Let's talk about UV light, especially in terms of our skin cases. We have like dogs that are different breeds, but also different colors in terms of pigmentation. Which do you find are most affected by UV light?
Certainly the white or the lack of pigmented animals. So that's cats and dogs. We've had an influx as well of the white cats. I always try and make light of the situation and say that that white cats are not designed for Africa.
No.
Because those little ears, if you start seeing right on the tips, you get those little black crusty marks that then start to extend down the margins and then also onto the inside and the outside of the ear. That's generally an indication that we're dealing with something that has been, the ears have been exposed to sunlight and UV radiation. And those can be rather nasty types of cancers, the squamous cell carcinomas for one thing.
And also on the nose often.
Correct, yeah. So the nose that's obviously a lot more tricky to get under control, certainly with the ears though, and they do phenomenally well after the procedure, but we actually end up amputating the little external bit. So we don't go right down to the base of the ear necessarily. It also depends on how severe. So obviously the easier or the sooner it gets detected, the less would need to be amputated. But that's then it's a routine procedure, and it's life-saving because otherwise that starts to get really, really horrible. So any of the white dogs, so like the staffies, if you get a white boxer, bull terriers, unfortunately, the Jack Russells, and most of these dogs love sunning themselves. So they'll go out into the garden and they'll be on their backs, and their little bellies are just getting absolutely baked. So you will never necessarily find anything immediate. It's always years down the line that it starts to then manifest itself. And literally, it was yesterday that I did. It's the 7th procedure that we've now done on this poor bully. So he is such a sweet boy, so gentle, but he has now got these squamous cell carcinomas that keep popping up on his belly. And unfortunately, with something like that, you just have to keep on taking it out, and it comes to a point where you can't really do that anymore.
Yeah.
So, this particular patient, we might be unfortunately nearing the end of what we can do for him. But I think in that regard, it's important to have some sort of protection if the dogs are going to be like that. So I think some more research has to be done into if all of the human suntan lotions are correct for cats and dogs. I think generally the children's or the sensitive or the hypoallergenic versions are probably better than just a normal stock standard. But if you can try and get something that's going to last the entire day, so you put it on once in the morning and that's it. So that you don't have to keep on reapplying, like when your kids are at the beach and stuff like that, or even get a little shirt or something like that. I know when I worked in the UK, they used to use them for post-surgery.
Yeah.
But that would be something, it's almost like a little leotard kind of thing that just keeps them covered, or just a T-shirt or something, just to reduce the amount of exposure that they then get.
I think a lot of people are concerned about even using suntan lotions with carcinogenic concerns.
That's why I think more research needs to be done into that. I think there are pet lotions available. I haven't really gone into that much depth of looking at what the active ingredients and the likes of that are. But I mean, it tends to be, if it's a veterinary product, it is going to be more expensive than the normal routine human stuff. So if there is a human version that's available and appropriate, I would encourage people to use it, so you're not getting the long-term effects of the solar radiation.
Keep your pets inside during the hot times of day.
Yeah, we were taught as kids, you don't go into the sun between, I think with Ben it was like between 10 and 2, the hottest parts of the day. So I would apply that rule as well.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
I suppose it's a good time for us to talk about that time of day, because it takes me back to our discussion when we were sat in the car and doing a podcast on heat stroke. And I encourage anybody who wants to go back and have a good laugh at us to go and check that one out, because it certainly
was an experience in itself.
It was tough.
I think it got the point across, though, just to see how, and that was how quickly, I mean, it was a hot day, and just how quickly the temperature rose inside the vehicle. Zero air movement. So it's just not great.
No.
Yeah. Won't be rushing into doing that again.
No, we've made our point, I think. So, I mean, that was really, like you say, we were trying to get the point across that you lock your dog in the car, there are going to be some severe consequences. But we also discussed at the time the impact of certain times of day and walking your dog. So can we talk about some of the, the typical, the hot times of day where we say keep them out potentially of the sunlight. But how would you advise owners who want to take their dogs for a walk we've discussed this before, but just a summary, to assess whether the pavement and where they're going to walk is adequate?
Yeah. So generally speaking, if you can't hold your hand onto a tarred or a hard surface, so that's concrete, tar, gravel, whatever, if you cannot hold your hand on it longer than 3 seconds, it is far too hot. So yes, you would be wearing shoes and the likes of that. Your dog doesn't have shoes unless you've got those fancy little booties on them. Otherwise, so they can actually damage the foot pads themselves with thermal damage. And that's going to be very uncomfortable. You can't exactly walk on all 4 burnt feet.
No.
If you can't literally, if you can even feel the heat, I would say radiating off the tar or a hard surface, there's no point in taking the risk for something like that.
So early morning walks, maybe later in the afternoon, try and walk on the grass. Still assume that there's going to be residual heat in the tar or on the pavements.
Yeah, absolutely. And then, like you mentioned, the timing of certainly not at 12 o'clock. And I know before we actually did that, when we sat in the car, we had a number of heat stroke patients, and it did boil down to miscommunication, misunderstanding. It was one of the domestic workers that was told, you have to walk the dog every day. And of course, then the owners aren't there to monitor or supervise something like this. They've just been told they've got a job to do. And it was over their lunchtime, which is 1 o'clock, that these dogs were then getting taken for a walk. And it was particularly hot, scorching days for that as well.
So these things happen, and we discussed it in detail. And again, this is just a summary for the listeners. If you want to get more in-depth information about why and how, go back and watch that podcast. But if you arrive and something's happened, whether they've been chasing monkeys, they've been locked in the car by mistake, they've gone on a walk and they've collapsed, and there are particular breeds, I'd love you just to remind us which ones are particularly prone. What do you do? What is the action points in order to try and save your dog?
Yeah. Bottom line is cool them down and as quickly as possible. Even if it means jumping in the pool, keeping their head above the water, and even on the step and just sponging, cold hose pipe, cold shower, cold bath, anything just to get that temperature down and try and get them cooler, have a fan going on them, put them into an air-conditioned room or something like that. And I would even then phone ahead to whichever vet you go to and just say, listen, this is the situation, because A, they will be able to give you more advice over the telephone and kind of gauge the severity of what's going on, but also then enable the professional staff to get ready at the veterinary practice for a situation like that.
Yeah.
So
we, in the event of knowing that this is a collapsed dog, are already setting up IV fluids, drawing up medication, informing staff not to make them sit and wait in the waiting room. So
because depending again on the severity, literally every minute counts. So everything is literally set up. The dog arrives, you can put that intravenous catheter in and start those fluids going. You can have the fan going. You can have varying cooling methods going as well. So that is the most important thing, is to get them as cool as possible.
And which pets are particularly vulnerable?
So those are our little flat faces, so the brachycephalics. So you're getting your Bostons, your little Frenchies, the bulldogs. Bulldogs, I think, are probably actually the worst. Staffies also to a certain extent. I've even had one with a Rottie. So any dog can get it, but we do find, because the thermoregulation is not nearly as effective in the flat-faced dogs, that they tend to be more prone to succumbing to the heat stroke.
And in terms of age, are there any particular ages that are more predisposed to the young or the old?
I don't think really, but I think obviously it'll hit potentially older patients a little bit harder. We do find in general that younger patients tend to be a little bit more resilient because they are a little bit younger. But I would say that, regardless, severity-wise, needs to be sorted out.
And what is it about certain breeds in terms of muscle mass that makes them more prone, other than obviously the anatomical thing of the brachycephalics and the short noses?
Ultimately, we all know when you've done exercise, gone for a run, even a brisk walk, you yourself are radiating heat. And that will then come from your musculature. So if you are a really, really heavy-set muscular dog and you are running around like a lunatic, if it is after the monkeys or jumping up at the wall at the monkeys, if a motorbike comes past, that sort of thing, that really gets them aggravated. And that overexertion can certainly increase the whole body temperature as a whole, which would be normal. But with that muscle mass, it doesn't dissipate as quickly as a thinner dog, for example. So certainly a big hulking bodybuilder of a dog is potentially then more prone to this sort of condition as well. Yeah.
So we may come back to this, I'm sure, because this is how we talk generally. But let's talk about the impact of warmer weather on parasites, bees, snakes. Can we go down that route now?
That's a thing as well. So all the flowers are in bloom, so the insects are out in abundance. So the most common will be the bees. One of our dogs at home as well, when we were growing up, we had the lavender bushes, and no matter what we did, apart from even literally like cornering it off, we eventually had to take the bushes out because if there was one bee, either the bushes would be flattened with the dog trying to then get to the bee, or the bee would be ingested in some way or form. And then you get the big puffy, swollen face, like they've been punched in the face. So thankfully with bees and dogs, they're not, like one or two stings, they're not nearly as sensitive. I know in my years, we've never had a dog having succumbed to sort of like anaphylaxis from bee stings. Understandably, if there's an entire swarm of bees, that's a different story. But if it's just a once-off little sting, they don't tend to be nearly as negatively affected as what humans are. So a human can get one sting, and that's if they don't have their adrenaline pen on them, that's game over. So, but yeah, it's so difficult to try and control that, especially the younger dogs. They're going to see anything moving. Let's go and investigate. And some of them don't learn their lesson, so they will
Even
carry
my
on
cats.
doing it.
My cats are silly. Like, the cats are smarter.
Yeah, shame, exactly. I always think that, I say that cats are a little bit more intelligent than dogs
but
with regards to
like,
that
I
sort
see
of
them
thing.
chasing insects, and then I'm like, that's a bee.
Yeah.
Gotta get stung.
Yeah. It takes one thing, you never forget a bee sting, that's for
Yeah,
sure.
I now know why kids cry like that, because I've been
it
stung
is.
as an adult, and it's really sore.
It's not a comfortable situation.
No.
Yeah.
So what do owners do?
So for something like that, and again, so it's not impossible that it could happen, that they do get a really, really severe reaction, but they need to be seen immediately. So we then give medication to then stop that allergic reaction from progressing and enabling it to be reversed as well. So it generally isn't too serious, like I say, if it is a 1B situation. I think you have done already one on major like swarms and bees and stuff like that. I mean, that's like I say, that's a completely different story.
Yeah.
But you would need to then get them seen to as quickly as possible.
Yeah.
Again, I haven't heard any reports, or certainly no patients that I've dealt with that have had, chest closure or wind air pipe closure or anything else like that. But they look very sorry for themselves, because their lips go all fat and their eyes close.
Yeah.
So it's not very pleasant for them either.
Tends to be
But it's
younger
easily,
dogs.
easily treated.
Yeah.
Yeah.
So we also have the situation where we're often presented with a patient and there is a swelling. I mean, maybe not that, but like what are you worried about when you see them acutely come in and there's a swelling, often sort of front?
Yes. So then, our reptilian friends that are out of hibernation and all the rest of that. So the frogs are breeding. I mean, they're croaking all night, every night. So they breeding season, and they're obviously one of the major food sources for snakes. So again, if you do see the little Jack Russells, I've even had a little Yorkie that's managed to shred a night adder. So I mean, they're tenacious little things, but it will inevitably be it'll be generally around the mouth or around the face that they will be affected. If you obviously see the snake, it makes it a heck of a lot more informative for the attending vet to decide what needs to be done. So obviously the more dangerous things, we do get the black mambas here, we do get the puff adders here. The rhombic night adders are not overly serious, so those can be treated often very, very successfully without any antivenom or anything like that. But the more, the more toxic snake bites, that can be problematic, because there is also a shortage of antivenom around, so it will be reserved for human use, unfortunately. So, but you need to either way rather just get your pet checked out. Usually they will be admitted for at least fluid therapy, painkillers and the likes of that.
And monitoring, especially if you haven't identified the snake, because we don't know. We're looking for progression of those clinical signs. So,
and sometimes, again, if the snake has been badly mauled, you're not going to necessarily be able to identify it. So then it is a case of just watching and seeing what sort of clinical signs present. Sadly, if it is something like a black mamba or a green mamba, I think
often dead
the
on
prognosis
arrival.
is we don't even really have time to even organize anything, unfortunately. So so that's something certainly to watch out for.
Yeah.
Yeah.
So we've done the more serious ones, but of course, going back to our conversation right at the start, which is our skin.
Yes.
We see the tiny, well, maybe you don't see. We have the tiny little parasites in the ticks and fleas that cause havoc. Can we talk about those? Maybe let's start with our ticks and then we'll go to the fleas, because the ticks we see some major issues with, particularly in this province.
Yeah. So tick-borne fever and Ehrlichia are the two main ones that get transmitted by the ticks. So usually if you're going out into a more public area like a park or something like that, then they tend to be more prone to pick up something like that.
Yeah.
It's not really that common. If you've got a confined area, you don't have anything moving through your property, for example, you might still get the odd one or two. So it's still very important, even if a pet doesn't leave the property, to still keep them parasite free, which then includes, there's various applications.
Yeah.
And I think that's an important discussion to have with your vets as well, as to what formulation might be more appropriate for your pet. with regards to the tick and flea. Do you want something that's going to last for 3 months? Do you still want something that's going to last for a month? There's external treatment, there's internal treatment. So some people are a little bit cautious about the internal treatments. I think it's an important to tailor make what is appropriate for your pet.
Yeah, and you in terms of application.
Yeah, well, that's the thing as well. So I mean, most of them are fairly easy to apply. If we dispense them at our practice during a consult or something, I'll put it on for them, or I'll dose a tablet or something like that. So at least you know it's getting done, and it's getting done correctly.
And the owners aren't the bad guys, because I tell you, even with my cats, they hate it. They really do not enjoy it. And I'm like, oh, I'll do that tomorrow. Yeah. And I have to confess, as an owner, I find it sometimes, I'm doing it too late.
Well, especially the kitties as well. You risk life and limb to try and get a tablet or something down there.
So definitely.
What I do find though, I think people's expectations for some of the medications might not be as accurate as what it actually is capable of. So with the internal medication, so it generally comes in a tableted form, and it tends to just be for the dogs, because you're trying to get a tablet down a cat in the grand scheme of things is never the easiest of procedures. Because that medication, the active ingredient, is then circulating through the system, the ticks and the fleas do still have to bite in order to get the active ingredient, and then they die. So they're not attached or bite long enough to necessarily cause an issue, but there is still the chance that you are going to see the ticks and the fleas on your pet before they get exposed to the active, before they then die. So it's not like the product is not working. It just means that it's probably a new addition to your dog or your cat that hasn't yet taken a blood meal, and it hasn't then been exposed to the active ingredient as yet. Okay. So that tends to be, most of the preparations nowadays are oral, particularly for the dogs, but you do get some still external ones, little spot-ons that you put onto the back of the neck that distribute over the dog over the course of sort of 24 hours. There's a specialized collars that can last for up to 8 months, which again forms a barrier on the outside. So that again comes into what is going to be most appropriate for your pet. Yeah,
and I mean, often it's a cost thing. People see that and they go, oh, that's a really expensive product. Like, well, it's going to last 3 months.
Correct.
So
if you break it down as a monthly cost, that they're all actually pretty much the same.
Similar.
But yes, to buy a 3 monthly preparation is certainly going to be more than a monthly one, and an 8 monthly one is going to certainly be more than all of them combined. But if you break it down into a monthly cost, they're generally pretty much all the same. Yeah.
So let's talk about Ehrlichia. What is it? How do owners, not that they have to diagnose it, but how can they sort of know that there's more than just their
Ehrlichia
dog
can be a little bit tricky because tick bite fever, a dog gets bitten, the parasite gets transmitted within 7 to 10 days or so. The whole saying, as sick as a dog, comes in, because these dogs are sick. Pale mucous membrane, so that's looking at the gums. If you pull down the eye, you see that soft tissue there. It'll generally be quite white. So as Ehrlichia progresses, you will still start seeing those sort of signs as well. It's not the easiest thing to detect on a blood smear, whereas tick bite fever, you look on a blood smear, it jumps out and bites you in the face. It can't be anything else. Whereas Ehrlichia is an elusive little thing. If you are lucky, you will be able to find it on a blood smear. Otherwise, we generally look. So if you do, for example, a hematology through the lab, those practices that are fortunate enough to have machines on site, like literally within 4 minutes, you get a result coming through. You then start looking for the telltale signs of what Ehrlichia would then start to manifest as. So it's just this, you might have found a tick weeks ago, and after the 7 to 10 days, you're like, oh, we're out of danger zone. The dog's still acting fine, but then as the weeks go on, they just become listless. It's really non-specific. But specifically if you're looking on a blood smear or then running a hematology, the platelets will tend to be one of the first things that starts to decline, and that should already start giving you a little bit of an indication as to what you might be dealing with. So tick bite fever, biliary, and Ehrlichia, they easily treated, and provided you get them in time, because both can can be quite nasty in the long run.
Yeah, and we were talking blood transfusions and whatnot the other day.
100%. Yeah, absolutely.
You may end up with what you thought was something relatively simple and straightforward that could have been avoided with preventative care.
That's it. Yeah.
Needing very intensive management, including a blood transfusion if it's biliary.
Yeah. Yeah.
So let's go back to our fleas, our itchy skins. Fleas we see. We don't always see, but we see some of the consequences in terms of these skin cases that we're managing. And obviously top of the list in terms of our paritic skin, itchy skin cases is to say you need to be trying to manage these parasites. Yeah. Why is that?
So with regards to fleas, they, breeding like rabbits, breeding like fleas. They it's nonstop. Particularly in our warmer climate now as well, we don't really have cold spells that are long enough to decimate the population. And again, if they've already moved into your household, your house is going to be warmer than the outside anyway. So it can often be very, very difficult if you've got a huge infestation, to get rid of it. So there's multiple modes. There's actually treating of the pet, there's treating of the environment. All pets need to be treated in the household. So just because your cat or your dogs might be outdoors and your cat's inside, fleas don't care. They will go anywhere and everywhere. So it's so important to keep all of your pets under control with regards to parasites. The fleas, it's one of the most common causes of irritated, itchy skin. There's specific locations on the body where you can tend to find them. It tends to be round about the base of the tail. And if you scratch them, then the dogs often do their little twitch, but you can often then get evidence of flea dirt. So some people mistake it for sand because their dogs might have been lying in the sand where they might have got the fleas from in the first place. But if you get that flea dirt or that grit and you put it onto a white piece of paper towel and you put a few little drops of water, it'll start then expanding and it'll go a red color. So that's actually the flea droppings. So you might not necessarily see this whole mass of fleas, for example, but the evidence is there that the fleas are there. And that's so important because not only can a dog and cats be allergic to the flea bites themselves, but it's the same as a mozzie bite. If you get bitten by a mozzie and you scratch and you scratch and you scratch and you scratch, it can often then get worse and worse and worse. So it's not an impossibility that if a dog has a flea infestation, that they could then start developing hot spots as well, because they scratch in that same particular location. If it's hot and humid, so they've got this little wound now because they've been scratch. It just becomes this horrible, rapidly growing, sometimes incredibly painful.
It's a combination between itchy and
horrible.
painful.
You don't know what to do. Like, you're so itchy, but it's sore. You don't know what to do. And often if it's that bad, we actually have to sedate the patient to clip that area and give it a clean. So again, responds beautifully to treatment, but it has to be done correctly. So those dogs that swim, any dog that might potentially have an ear infection that they're now scratching to try and get at the ear, this area here, particularly in Labradors and Rotties, because they've got that thick fur around their necks as well. So if it's wet, they have now caused trauma. You've got the humidity. It just is this beautiful little shield where the little skin microbes then just grow out of control as well. And then you get this horrible, and it will literally double in size in a day.
Yeah. So, and you made one good point. You mentioned swimming. So that's the other thing I wanted to cover with us, hot weather. And I know you say that they swim all times of the year, but my pets particularly like to swim when we're in the pool.
Yes.
Let's talk about the near drownings, because that is something that we also see, particularly with young dogs, when this time of year with puppies coming into the mix. What do owners need to do? Why is it important that they come to the vet?
Well, I think first of all, you need to make sure that your pet can actually swim. So most dogs, if they enjoy running around the pool with the kids during playtime and swimming time and stuff, I mean, if they're doing their little tick around and they're absolutely fine, it's those dogs that tend to lose the ability of using their back legs when they're swimming, and then they kind of just go like this and then down they go. So it will be a natural reflex for them to initially actually hold their breath. Understandably, if there's somebody there immediately to get them out, then that's fine. The problem comes in, yes, if you don't get them out in time, and then they can actually still inhale water. So that's an immediate vet visit. And again, heads up to whichever veterinary practice you're going to, because every minute is essential. So that is thankfully something that we haven't had to deal with very frequently, but it absolutely is a worry.
People don't realize if it was in the bath, it's still not ideal, near drowning. But the fact that we use chemicals in our pool, the chlorine and the impact of that on, that it's so important that they need to appreciate that this is not something that should be ignored, because you don't always see major issues within the first few hours. No, this is something that can be progressive.
Delayed. Yeah. So you might think, absolutely, oh, shame, they've been under the water. Oh, everything sounds fine. But obviously, if we then listen to the chest with a stethoscope, even if you take x-rays to see what the extent is. So fluid in the chest, I always say that x-rays are a beautiful modality for the chest in particular, particularly if it is then for fluid or anything like that, because you get those massive contrasts. It should be black with, you see your trachea coming in with your cardiac silhouette, and you should get your nice little black triangles on the image. So again, if they're filled with fluid, it's going to be a very, very different picture. So at least getting a definitive answer like that as well will then steer the treatment in the right direction as well.
That's great. Well, I think we've covered most of the ones that we wanted to under this hot weather increasing things. In part 2, we're going to discuss our intestinal issues. So, I mean, obviously very applicable also this time of year where it's festive, people are braaiing. So we're going to discuss those kind of things in part 2. So.
Awesome. Cool.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hypo what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can I get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Gets it all to your door.